Involve your physician or your medical provider in all of your treatments. really is no good, solid, and reliable medical information or studies that indicate that it has any beneficial effect in the treatment of COVID. There are very official looking websites online where you can read about it, and a lot of them point to one particular study that came out of Egypt that showed benefit for treating COVID with ivermectin. What they don't say on those websites is that recently, when analyzing the raw data from that, it turns out that that was not probably the best designed study, number one, and there's a strong suspicion that most, if not all of that data was faked. So that preprint publication on the website has been withdrawn, and is when you factor that in, there really is no good evidence that ivermectin is a beneficial treatment for COVID. Now, that's not to say that there are not drug companies, particularly Merck, I know, is looking at all kinds of treatments that might be beneficial in the treatment of COVID, and they are looking at ivermectin. There are plenty of people who are out there designing well-designed studies with a lot of subjects, and eventually the medical community and the research community will determine, yes, it works, no, it doesn't. We're just not there yet.
I mean, and that's like a lot of things. I mean, they're looking at so many different things. So somebody just hears a rumor that ivermectin is being, studied for this. It's among so many other things, and out of millions of ideas, a handful might actually shed some light on it, right? I mean, that's kind of how research works.
That's correct. They're looking at all kinds of different chemicals and combinations of chemicals and drugs in order to treat COVID. To date, the most effective things that we've seen are vaccination and masks. Anything else that might be a cure or preventative is way, way down on the list as far as effectiveness and also as far as proof.
So really what you've just been saying kind of answers this question, and maybe just kind of say it one more time, just kind of to summarize, but that if ivermectin has been shown to have any benefits, which you said it doesn't, but why would health officials not strongly explore it as another tool in the fight against COVID? And they are exploring it.
Absolutely, yes. There are many trials that are registered that are well designed, and as I said, have a great number of people that are enrolled, and they're trying to determine with a great deal of accuracy whether or not there's any benefit from ivermectin. It's very tempting for people to kind of reach out for any kind of preventative or cure. COVID is scary, and we've been locked up in our homes and wearing masks for over a year now, and we all would like to get past this. It's very tempting when somebody comes online, for example, on the internet, puts up a very official looking website with referrals to medical literature. It can be very, very tempting to take that advice. Unfortunately, when you look at it in detail, it kind of falls apart under scrutiny.
So we understand that some medical providers, so MDs probably, or DOs, are prescribing ivermectin as a COVID, or they're prescribing it for what it's approved for? Because people are saying, but it's being prescribed. But
Right.
are you hearing that they're prescribing it actually for prophylactic for COVID, or what? What are you hearing?
There are physicians and other providers who are prescribing ivermectin, the human formulation, specifically to treat or to prevent COVID. That is well within their rights to do so. It's what we call off-label prescribing. So when a drug is released onto the market for use in humans, the prescriber can use that medication however he or she sees fit. So for example, if a new arthritis medication comes out on the market, and somebody has the idea, I might, would that work for a patient with heart disease? They can prescribe that and ivermectin is kind of following along that same. There's a human formulation available. We have prescribers that are prescribing it for their patients, and to date, I'm not aware of any significant adverse effects from that. I guess my take-home message from that is that if you're considering using ivermectin, or it's tempting to go to the feed store and purchase some of it, let your prescriber, your physician, know that you're interested in doing that. Let him or her decide whether or not it's appropriate. Review the medications you're on, see if there are any interactions, and you can make the decision from there. Don't try and wing it on your own.
We don't have any new questions, but because the beginning we were having maybe some issues, and we
Sure.
want to make sure that we have captured everything, could you start just your presentation at the beginning, just talking that story you heard about the
Sure.
other state where they,
Yeah.
sorry.
Yeah, my name is Scott Schaefer, SCOTTSCHAEFFER. I'm the managing director of the Oklahoma Center for Poison and Drug Information. I'm a pharmacist and toxicologist. This past weekend, my ears perked up when I started hearing news stories that indicated that 70% of the calls coming into the Mississippi Poison Center were related to humans taking animal-based or ivermectin intended for animals. That didn't sound right to me. So I came in Monday, contacted the director of the Mississippi Center, and found out that actually there was a great deal of misinterpretation as far as their data, that only 70% of the actual human cases of ivermectin exposure were due to humans taking the animal product. So it actually is a tremendous difference. When you run the numbers, maybe 18 calls related to humans who had taken animal ivermectin. Well, that information that came out kind of snowballed, and a lot of questions started being generated about ivermectin, prompted me to go look at our number of calls, and found that we don't have as many cases as Mississippi reported to us, but we had 1 call about it in May, 3 calls in July, and 6 calls regarding 7 patients total in August. So interest is kind of ramping up in the state, and we're keeping our eye very closely on ivermectin being used, particularly humans who are using products intended for animals.
And would you just go over the symptoms again that you're mostly seeing, and just explain that you didn't see, you haven't seen any or heard of any really serious symptoms, and then I think we should have everything we need.
Okay. The most common effects that we've been seeing with ivermectin exposures have been relatively minor in nature. We've seen upset stomach, nausea, vomiting, and some dizziness. That we have not seen anything that would require hospitalization, certainly, and we have not seen any fatalities. All of these cases we've been able to manage at home. Our pharmacists and nurses who are manning the phones have provided instructions maybe to give somebody some relief, and we'll follow up at home in order to make sure everything's okay. Nobody has required medical treatment for the adverse effects.
Perfect. Will you tell the viewers what number do they call?
Sure.
For you?
Yeah. If you have any questions about ivermectin or any kind of exposure, maybe your child got into something, you have a question about drug interactions, herbal products, we've got pharmacists and nurses on the line 24 hours a day, highly trained in toxicology, and we're available statewide at 800-222-1222.
Any takeaways from that, just from your last comments?
Yeah. In general, I advise people to involve their medical team that cares for them, primary care physician, prescriber, medical provider. with any kind of medical treatment that they're considering or would like to know more about. Your doctor really needs to know about medications that you're taking so that drug interactions, maybe interactions with medical conditions you might have, might be present, and have an open, honest discussion with your doctor.